Good evening, everyone. On behalf of the Independence Blue Cross Foundation, it is my pleasure to welcome you to our panel discussion on uncovering health inequities and what it takes to prioritize parity. I am Lorena Marshall-Blake, the president of the Independence Blue Cross Foundation and vice president of community affairs. I can't begin to tell you how glad I am to moderate this panel tonight. Again, thank you for joining us for this critical discussion. You know, I have many sheroes and heroes, but one of my sheroes, Maya Angelou, once said, "We all should know that diversity makes for a rich tapestry, and we must understand that all the threads of the tapestry are equal in value no matter what their color." Unfortunately, our communities of color, including our Latino communities, have been disproportionately affected by COVID-19, highlighting a serious lag in the prioritization of health equity. You know, when your zip code determines your life expectancy, that's not justice. Each person on this panel recognizes that, and they are working to make a difference. I'm saying that they are mad people making a difference. Tonight, we will have a conversation. Let's talk about it, how to strategically address health inequities and work to improve health outcomes for medically underserved communities. Let us uncover health inequities together and do what it takes to prioritize parity. Really, that's called leveling the playing field. Before we get started, I want to ask each panelist if they would introduce themselves. I'm just so excited that they're here. So I'm going to ask George if you would mind leading off.
Thank you so much, Dr. Lorena, for having us. It's a pleasure to join you. My name is George Fernandez. I'm the founder and CEO of Latino Connection. We are a social determinants of health agency. I founded Latino Connection in 2015, and we are based here in Harrisburg, Pennsylvania. We basically help organizations reach low-income sectors and communities and essentially connect people to resources that they mostly need.
Okay, Dr. Stanford, if you would go at this time, and then Heather, if you would follow. Someone is calling us.
Hello, can you hear me?
Yes, thank you so much, Dr. Stanford.
Hello, everyone. I want to say hello, Philadelphia, but there might be folks in Harrisburg or other places. My name is Dr. Ayla Stanford, and I am a pediatric surgeon and founder of the Black Doctors COVID-19 Consortium, which began in March and April of 2020 to address the lack of access for coronavirus testing, particularly for African Americans, as they were found to have more disease and more death from coronavirus. And so that was the mission. Our mantra is access, empathy, and action. And we are 10,000 and greater in terms of testing in southeastern Pennsylvania. And thank you all so much for the invitation.
Thank you so much, Dr. Stanford. Heather, if you would introduce yourself.
Sure. Hello, everyone. It's great to be here tonight with such esteemed panelists and our moderator. I want to thank everyone for tuning in for our conversation. So my name's Heather Major. I'm the Director of Programs for the Independence Blue Cross Foundation. We are a private charitable corporate foundation that was established in 2011 to formalize Independence's commitment to the health and well-being of the communities in which we work, live, and play. Our foundation is truly a national thought leader, and we're also a regional grant maker to nonprofit agencies and academic institutions in southeastern Pennsylvania. Our work over the last 9 years has really helped to strengthen the healthcare safety net, and we focus on access to care, which we're going to speak about a lot tonight. The organizations that we fund operate in medically underserved areas. They serve a disadvantaged or vulnerable population, and we actually try to reach into populations that are defined as low income, racial and ethnic minorities, the uninsured, children, the elderly, homeless, the disabled, veterans, and populations that suffer from specific chronic diseases such as HIV and addiction. So really our role tonight is to talk about partnerships and talk about what we're hoping to achieve with the great work of Dr. Stanford and George Fernandez.
Great. Thank you so much. Again, I'm just excited about all of you being with us tonight. Again, Dr. Stanford and also George, you've started to talk about your organizations. But again, could you talk a little bit more about the populations that you're serving? And again, as you're doing that, again, what you hope to achieve in that process while you're doing it. And George, I'm going to start with you. How's that?
Wonderful. Sure. So we're really excited that Latino Connection was a catalyst in recently launching an amazing initiative in partnership with the Pennsylvania Department of Health and supported by Independence Blue Cross Foundation. And we're really happy to have launched what's called CATE. CATE is our COVID-19 mobile response unit, traveling across the Commonwealth of Pennsylvania. Today was its 18th stop out of a 32-stop tour.
Wow.
And tomorrow we will be making our first stop into Philadelphia counties. So tomorrow we will be in Bucks County. So we're really excited to be in Bucks County and to reach, not only Philadelphia counties, but its outer counties, Chester, Delaware, and so forth. But the purpose of why we launched this was, at the peak of COVID-19, when we learned that Latinos and African Americans were highly disproportionate being affected by COVID-19 than whites. We essentially wanted to create an initiative to reach that community, not only to leverage testing, which is what Kate is doing today, but also to provide further education and to help prevent the further mitigation of COVID-19.
Great. Thank you so much. We have several things going on tonight. Dr. Stanford is also before the Center for Disease Control. In addition to, she's also working with us tonight also. So we're going to be bouncing around and we will come back because I see her talking right now to them because she's on the advisory committee. So George, I'm going to stay with you for a minute. Matter of fact, Heather, I'm going to pivot back to you just for a moment with the question again, when we talk about the issue of health disparities in the Latino community, African American community, and we look at the foundation and how we address it and how we're looking at it. And I think, again, even I'm a little ahead of myself, but talking about even the partnerships that we have with them. Okay, thank you.
Sure. So George mentioned, and I can only echo that COVID-19 has really exacerbated health disparities and needs in our communities of color across our state, and that happens more than other populations. These are populations of people that have been disproportionately affected for decades. In fact, we were looking into some information about this. The racial disparities and systemic issues were really the subject of IOM reports, the Institute of Medicine reports, nearly 20 years ago, and we're still talking about them today. So it really is time for change. For us, efforts like Black Doctors COVID Consortium and the Latino Connection really create that opportunity for change. They're immediately filling a gap, increasing access to COVID testing in communities where those greatest health disparities exist. And Lorena, you were talking about your zip code determining your lifespan.
Yes.
And those are the zip codes that Dr. Stanford and George are making sure that they are visiting. But they've also become a source of trusted care in our communities and culturally competent care for our neighbors. And that means that they can do other things, such as offering vaccinations and offering ongoing health education promotion. But I think, if you're moving upstream, they're also exemplifying very successful public-private partnerships and what that takes. And they're going to talk more about that tonight. For us as the foundation, Lorena, you know this as well as I do, their work aligns with that of the health centers that we support to improve access to care and serve the diverse cultural, health, and social needs of the communities they serve. So I think we're very fortunate that we've been able to be a first supporter of their efforts. I see Dr. Stanford.
Right. And I love children. Children always show up when you don't want them to show up. She has 6 children. Okay. So let me see if she can cut in at this.
Oops.
All right. Okay.
Hello.
We saw the children. That's okay. We saw the children. And the question that I just posed, again, talking about the populations you serve and talking more about the issue of health disparities in the African American community and how this addresses that which you're doing with the Black COVID doctors.
Well, the health disparities really began with access. Everyone wanted a test. And at the time, it wasn't known that Latinx folks and African Americans were going to be so disproportionately affected. Everyone was focusing on healthcare workers and the elderly.
Right.
That was the priority. And so for us, once we found out, it was how do we improve the access since there's no treatment and there's no cure and not yet a vaccine. The only thing in our armamentarium is to test. And then once you know your status is to let everyone you've been in contact with know so they can then be tested and or quarantine or something. And I think what's so unfortunate is many of those lives were lost. People didn't know. They didn't know. And that, honestly, it hurts my heart for the people who kept going back to the ER, kept trying to get tested. I'm going to give you a quick example. I talked to, and I'm going to say his name is something different, but Mr. Martinez. And he went to an emergency room with COVID symptoms, and he was with his wife, who was not Latinx. And the nurse said to her, "We're going to need you to stay to translate." Now, he never opened his mouth, but her assumption, her bias, before he even opened his mouth was that he couldn't speak English, but he spoke fluent English, right? And that's where the health disparity really begins, because you have these preconceived notions about someone. And then he was diagnosed with pneumonia, but he was discharged and was never COVID tested. And this was in May when we knew better. Anyway, he was sick for months and fortunately survived, but still has residual symptoms. And I just point that out to say, because sometimes people get upset when you're talking about underrepresented groups or at-risk groups. And why do you need someone who takes care of Latinx, or why do you need someone who takes care of just Black patients, which, by the way, we test everyone. It's because of the biases that are intrinsic and part of the fabric of our healthcare that we need people like myself and people like George that understand what exists so we can provide that access and be empathetic when someone is having a problem figuring out a form or not, just because they've been turned away and they're so, hesitant because they feel, a certain way. That's the empathy that comes in, and understanding someone's challenge. And finally, the cultural competence. That's what we bring that sometimes our colleagues don't have. So the purpose, the health disparity, is because of all those reasons I mentioned. And the need for us being present is to break down those disparities.
Okay, great. Okay. George, did you want to add anything else to what Dr. Stanford has all said, or I'll just move on to my next question, which I have for you guys?
No,
did you want to say anything?
I just, the folks that we're reaching with Kate, just today we did our first stop here in Dauphin County, and just to hear the real stories of real people. Yeah. Today we met a gentleman who has been having symptoms for quite some time, but not enough symptoms.
Another one.
He lives with multiple members of his family, and he hasn't spent time with his family in at least 7 or 8 days. And he couldn't find a place in Harrisburg to test him. And he was tested today, and he should have his results as early as tomorrow. So the fact that initiatives that Dr. Stanford came up with, and the fact that the initiative that I came up with are supported by foundations and organizations like yourself at IBC is a blessing, because without the support of your organizations, we would not be able to reach the thousands of people that we are reaching together collectively. So
well, I can say the foundation and the independence, it's the right thing to do. It's the right thing to do. As a matter of fact, as you both have been going out and testing folks, when you look at social determinants of health, what other ones have you seen identified? So they may have come in, you mentioned pneumonia for COVID, but what are some of the other comorbidities or other determinants of health? And again, when that happens, what then do you do? And Doc, I'll go to you, and then I'll go to George.
Lorena, it's tough. This one's a tough one for me, because surely if your kidneys aren't in great shape, or better yet, if your lungs aren't in great shape because you have COPD, or as a child you had cystic fibrosis, or you worked with building and you were exposed to asbestos, and then you get COVID, which we know causes pneumonia, you're going to probably have a poorer outcome or a longer time to recover, right? So that is known. But the issues that people are having are not because they have diabetes or because they have hypertension or things like that. You know, Mr. Martinez that I mentioned as an example, the reason why he got delayed his testing and delayed his treatment was not because he has diabetes. It wasn't because he has uncontrolled hypertension. It was because he couldn't get access to get a test. And so I just don't want us to say that it's the patient's fault and that we blame the patient. And in medicine, we are not supposed to do that. We're supposed to help and enable a patient to do better for their own health and advocate for them. And so I caution that because I don't want the narrative to be it's because you were unhealthy that you had a poorer outcome. Now, if you're unhealthy and you keep trying to get tested over and over and over, and by the time you eventually get tested and you get medical attention, you're so far gone that the supportive management you could have gotten doesn't really have a chance to work. Yes, but that's not, I do not think that should be first and foremost. The first and foremost is when you see someone, don't not test them because they're, quote, not sick enough. George, I've heard that too. A lot of people who come to me say, well, I tried to get tested at work. And these are healthcare workers in the hospital who are.
We had one today.
Yeah, a supervisor who's white who says, well, you have some symptoms, but you're not quite sick enough. And then they come to us and they're positive. So that's what I'm talking about. So I don't want to. Okay. Of course, if your organs aren't strong and you have an infection, then yes, you can have a poorer outcome. But all of that can be prevented that the first time you present to healthcare, to a healthcare system, you are taken seriously and given the attention you need.
Very good. Okay. George, did you want to add anything to Dr. Stanford?
Yeah, I mean, I just think that there's we're seeing so many other concerns that are coming up already. I mean, flu season is upon us, right? And what's really cool is that our COVID-19 mobile response unit at all of our locations, we have a community health worker. So a community health worker looks up the local resources that are available after that mobile unit, kind of leaves town. What are other resources available to people that we may have missed that day? So we put together what are called community resources overview and sheets to hand out to folks. And we're partnering with other state departments, such as the Department of Aging, the Department of Health, the Department of Human Services, the Department of Banking and Securities to provide additional resources around programs that are related to COVID-19. One of the programs that we like to highlight on the tour is a partnership with the Pennsylvania Housing Finance Agency, which is the Rent Relief Program Assistance. So if anyone is, behind on their rent and or they're in potentially being evicted, we can connect them with organizations like the Pennsylvania Housing Finance Agency to connect them to resources around rent relief programs and things like that.
Yeah. One of the things that, as I listen to you and Dr. Stanford, again, is being that healthcare workers and others need to be open-minded, not have these preconceived notions when you walk in. It's almost one of my favorite, and Heather always hears this, my favorite quote by Dr. Maya Angelou, where she said, people won't remember what you said, they won't remember what you did, but they will always remember how you made them feel. Mm-hmm. So it's important that people feel as if they're important and that they're, they matter, that they matter. Did George disappear or is he still there?
Oh, I'm sure he'll be back.
Okay, fine.
Sometimes the Wi-Fi does that.
Okay, all right. Okay, so again, I'm gonna move on with regard to our CEO Dan Hilferty. We often hear him say that healthcare is a right. not a privilege. Okay. And so and Heather, I'm going to even include you in on this. Tell us more about your strategy to making healthcare more equitable. I often hear about diversity and inclusion, and I know equity is an important word for you, Dr. Stanford. So I know there are some things even down the road when we look at equity. But again, when we talk about that, when you look at your own strategy, and I know you have one, and it's not just for today, it's long term.
Yeah.
How's that?
For equity?
Yes. Mm-hmm.
Well, I don't think we have enough time on this call.
Okay, but that's okay. You got 2 minutes.
2 minutes. Okay, I got 2 minutes. Okay. So, okay. First, the things we know. So evidence has shown that when African Americans care for African American patients, the health outcomes are better. Now, wouldn't that just be easy? It's not, because there are only 4.5% of active practicing physicians in the United States are African American, and we represent 13 to 14% of the population. So there's 52% of white physicians. So what does that mean? That means that we, and I'm including myself as a healthcare professional, all have to acknowledge our own implicit bias that we all have when we walk into a room. And we have to acknowledge it, but then make a conscious effort to change certain behaviors, to really think about and sometimes say to a patient, how did you feel? Did I address everything on your visit? I want you to tell me exactly how you felt. And when you say that, look them in their eyes, sit down when you say it, and don't look like you're in a rush, right?
Okay.
And listen.
Exactly.
So it would be easy to say, okay, Black doctors treat Black patients, but there's not enough of us. So we've got to work with who we have. Everybody's got to be culturally competent. We all come into this with our own experiences, our own bias, our own preconceived notion. We're human beings. We're supposed to have those things, right? But when they can be deleterious to a patient, then it's up to us to acknowledge that as an individual. And then institutions have to also make changes on an institutional level. And I think that's 2 minutes, 30 seconds.
Okay, you're up. Okay, your 2 minutes are up. You actually went over, okay, but that's okay. All right. All right. Again, Heather, I'm going to come to you for a moment, only because when I look at all that we do through the health centers, and again, looking at our strategy for the foundation, and how we operate and how we function. So if you could address that, and then George, I will swing back to you. Okay.
Sure. I mean, I think what Dr. Stanford just said really ties well into what we're trying to do with our signature nursing internship program, promoting a diverse and culturally competent provider community. And that we feel starts when you're an undergrad, an undergrad student nurse, and you're exploring opportunities in your field. And through our program, we're able to provide community-based internships with our health centers. And our health centers are there for the community. There's an old saying that if you've seen one health center, you've seen one health center, and that's by design. Those health centers are there to deal with the specific needs of the communities that they serve, and those health centers really do a great job of serving not just the health, but the social needs. And Lorraine, you were mentioning the social determinant, and they do a great job of that. So I think that's part of our strategy. I would just add that, working with grassroots organizations like Dr. Stanford's Black Doctors COVID-19 Consortium and like Latino Connection, that's really important. And then working with our government agencies, that's all part of creating healthy neighborhoods and safer communities. And that's what we do.
And Heather, I think you're correct again, and everybody has mentioned, it's about the community, okay? It's not about us, and we don't dictate, okay? You live there, you know what goes on. So we come in and hopefully can be, I'd say, partnerships with purpose, where we partner with Dr. Stanford and we partner with George, Latinx, in an effort to make it better. We don't come in with these preconceived notions, because I know people can do that. George, did you want to add anything or say anything with regard to your own strategy? And I'm sorry, one night you just woke up and said, this is what I'm going to do, and this is how I'm going to do it.
Yeah, and I was getting goosebumps as Dr. Stanford was talking, and it's really about having empathy and treating people like humans. I think that we are forgetting to humanize healthcare, and I think that we need to get back to understanding that they're not just a patient ID; they're an actual person, and there's a story. We all have our story, and we too, just like Dr. Stanford, when we knew that Latinos were being most affected, along with our, Black and our Black African American friends and family. We needed to get out there, and my team and I joke around, and we call each other healthcare warriors. And we said, you know what, we're not doctors, we're just community health workers, but we need to get out there and reach our people. And I was tearing up when Dr. Stanford was talking, because you see people at these events, and they actually say thank you.
Yeah.
It's heartbreaking.
Yeah.
That we are the solution, and that we in our community have sort of let them down. And the efforts that Dr. Stanford and I are doing, and everybody else is doing, perhaps are not even enough. We only scratch the surface. And these were already communities that were having an uphill battle against so many other social determinants of health factors. And we're just really happy to be a small seed in the needs of our community.
Great. Thank you so much. Now, Dr. Sandra, I know on your other call, you were dealing with the advisory committee and also the Center for Disease Control. And this particular question is, how is this initiative adapting to the ever-changing CDC guidelines for testing? Because I know things keep changing. So, I mean, I address that to both you and George. I mean, one day it's this, and then the next, and we want to talk about the political ramifications.
Yeah.
I'll leave that part out of it. I promise I wasn't going to do that. But could you address that?
Well, sure. So the one thing I've learned from this whole thing is you don't make any sudden moves or sudden changes, because on Monday it's one thing, and by Thursday it's back to what it was on Monday. So everyone got up in arms about 2 weeks ago when the CDC said, stop testing asymptomatic people, right? And now we're back to testing symptomatic people. So the beautiful thing, or asymptomatic, the beautiful thing about being a private practice physician, and the fact that 45 said the cities can do what they want, the states can do what they want, I'm just making recommendations, is that I can decide what's best for the patients that I serve, because I don't have a federal mandate, and because I don't work for a particular hospital. So I can make my own clinical decision. So am I just randomly testing anybody? No. I mean, these tests are hard to come by, and so I do use scrutiny. However, if someone says they live in a house where someone's positive and they've had direct contact, but they have no symptoms, yes, I'm going to test them. But a lot of times, if you go to a hospital, I've heard people say, well, they just told me to quarantine for 14 days because I don't have symptoms. But they've been within 6 feet for longer than 15 minutes because they live with the person. Not everybody can just say, okay, great, 14 days, I'm going to stay home, because they're either not going to get paid, they don't have, paid time off. How are they supposed to support their family? So the recommendations are not one size fits all for all communities. And I think those of us who know that need to work with individuals and meet them where they are. And that's what I'm doing. Regarding the COVID-19 task force with Philadelphia Department of Public Health and CDC, I appreciate the fact that they invited me.
Me too.
That they decided that the input I can have in the community is valuable. One of the things that everyone echoed was safety, efficacy, transparency. Everyone. So I think that's a great place to start a committee. And so I'm excited to be at the part. I love being able to give unfiltered responses and factual information. It's a nice place to be.
Okay. George, did you want to comment or
Yeah, absolutely. I mean, our mantra or our tagline with Kate is sharing facts to erase fear. And the immigrant community in the Hispanic community tends to be very large. And there's a lot of myths and a lot of articles that talk about, if you're out there becoming positive, you're going to get deported, or by missing work, you're going to get deported, and things like that. So we're really out here. And because Latino Connection, we are our own entity, and we select partners and testing partners and provider partners that go out into neighborhoods. We kind of get to make the decision in partnership with the Pennsylvania Department of Health as to who gets tested. We too are being very careful as to who gets tested. But most of the, I would say about 60-70% of the scenarios that we run into are folks who are living with someone who is testing positive to COVID-19.
Right. Again, when I see Dr. Stanford and George, when I see you also, there's a phrase that's become one of my favorites, trusted messages from trusted messengers. So you indeed have the trust of the communities that you live and work in. And when they see you coming, you embrace them. I think it goes back to the empathy, and you can't fake when you care. Yeah. Okay. In other words, it's like, don't tell me you care, show me you care. So again, I'd see you two as trusted messengers with trusted messages, which brings me to a question with regard to, especially depending on, you've seen one community, they're very different, about education, the importance of education. So if either one or both can comment with regard to education of the community.
I think one of the biggest things I faced in the very beginning were all the mixed messages that wear a mask, don't wear a mask. It's airborne, it's not airborne. You had to be with someone who was in China or Italy or Germany, and that's the only way you could get it. So I spent a lot, this was 5G. Then it was, if you take elderberry and sea moss, you can make it go away. Then it was, if you could inhale saline, hot saline, and blow it out, put Vicks on your chest with a humidifier, you could make it go away. So the biggest thing I did as I heard these is I listened, and I did not dismiss them at all. And if they were safe, and there was no harm, and it didn't affect your immune system to take turmeric or something like that, I said, do it. But
Doc, I use Vicks.
Okay, exactly. Listen, our grandmas,
I use Vicks.
I'm never, an 85-year-old woman tells me she can cure her. I do not. Who am I? I haven't lived to see 85. But what I say with that education is, do that, but still wear your mask. Still don't go out as much as you may have previously. Stay away from folks in large gatherings. Wipe your surfaces down with bleach a little more. Wash your hands more often than you might. But I did not discredit. And I think, again, that goes to where people are. Because in the beginning, when we were home, that was the message. People might have been off for a couple of days, but those face front employees that have to go to work to get paid, they went back to work. So when all the messaging started to change and you had to watch CNN every day to get the information, the folks that needed to hear it the most were at work. Yeah. And they were like, this isn't something, this is rich white people who take cruises. This has nothing to do with me. Because that's how it was portrayed, or someone who was in China. So people thought it had nothing to do with them. And so to your point about education, when we were out there, yes, we tested, but we answered all the questions. I did a lot of social media live and Facebook live and Instagram live. I talked to different generations, especially the young folks, and I listened. And when they said it was 5G, I said, okay, maybe it is. Who am I? But that doesn't stop you from wearing a mask.
Okay, very good. Good point. George?
Yeah, I mean, we're seeing the same thing, in very concur messaging than what, Dr. Stanford is saying. But for us, primarily, it's helping to connect people to resources once the mobile unit is gone. And with your partnership, we are literally putting, resources into the people's hands that need them most. We're still meeting people that have a disposable mask that's falling apart. And, with our Cape mobile unit, we get to hand out these really amazing, breathable, tools and resources.
Is that Independence on there, I think?
I believe it is.
See that?
There it is.
But, I mean, how hard is it to find a mask that you feel comfortable with, that you can wear multiple amounts of hours?
You can wash it and
Thank you.
Reuse.
Yes.
Absolutely. Yeah. And this is one of them. So thank you again, Dr.
You're
Lewis.
so
Thank
welcome.
you, Heather, for your support and your partnership, because we're taking this is a tool. This is a tool to keep someone safe. And we are literally putting this into the hand of people that need them most.
Yeah.
So thank you again.
Well, you are so welcome. Okay, now I'm going to ask you, and I'm going to give you each a minute or two, okay, for a question that you could talk forever on this one. And I know this. And my question is, why is this personally important to you? Why do you do what you do? Now, you only got a minute, okay? So don't get, maybe two.
George,
okay?
you're going first on this one.
Okay.
Listen, I'm going to be 30 seconds, so I can give you a minute 30, okay? I'll tell you very quickly. I'm a product of a single mother of 3 who never qualified for social assistance or social human services because we were immigrants. And the challenges that my mom had to overcome, I had to become a young adult at the age of 11, and I became her right hand, her interpreter. And the challenges that my mom had to overcome are essentially the backbone of the services that Latino Connection offers today across the Commonwealth of Pennsylvania and other 16 states across the U.S. So for me, this is a calling. I could be in corporate America, but it's not what makes me want to get up every morning. And when I see single women out there with kids, like I saw today, this morning, I see those people as my people, my mom. So I'm here to overcome those barriers that I had to overcome at a very young age.
Yeah, great. Doc?
That's my story. I don't have anything to say.
You have anything to say? Okay,
Just-
right.
Story.
You know,
I can say something real quick.
Yeah, I knew better.
Especially for Philly. And I know you said you're in Harrisburg. Like, I mean, it wouldn't matter if I was anywhere, but I was born in North Philly at Einstein. You know, my parents were young, you know, and
yeah,
you know, people,
It's okay.
they didn't expect,
yeah,
the expectations were so low for you, you know, and it really only takes one person to see something in you and push you just a little bit.
Yeah.
Or for you to see another part of the world and want to have it for yourself or for your family.
Yeah.
And I've been so blessed in my life with my education, with my collective family that raised me and my mom, and helped my dad at such a young age that it's my responsibility. It's my responsibility because every time I'm out there, and especially the young kids, I see myself in every one of their faces. And I want them to know that they can be a doctor. Your parents don't have to make 6 figures. You don't have to go to private school. You can be educated in the Philadelphia public school system. You could be on public assistance. You can have holes in your shoes. You can shop at the thrift store. You can get government cheese, and you can still become a doctor.
Exactly.
And the opportunities now are way more than what we had. I'm older than you, George, but way more than what
I'm older than you too. Okay.
And so it's just, I mean, when I heard that.
And again, I think, George, you said it, and Doc, you said it, and Heather, I'm going to let you jump in too, because I know I'm not going to let you off the hook on this one. It's a calling, it's a mission. It's all about, it's not about me, but it really is all about how can I enhance the community that I grew up in, where there are some people who are still there when I was there, that are still fighting the good fight, that are just trying to, what is it? A wonderful book by Dennis Kimbrough called What Keeps Me Standing, where they say surviving is easy. It's the living that's difficult. It's that day-to-day stuff as you just try to make it. So, so again, it's the right thing to do. And what is it? It's just like breathing. I could not imagine not breathing. I could not imagine not giving back to our community. Heather, did you want to chime in on that or say anything?
I would add that I'm a Philadelphia transplant. I've been in Philly. It'll be 18 years. And when I came here for a job. I came here for a job with Independence, and I moved here from the central part of the state. And so I've had this experience of having family in, the coal regions of Pennsylvania, growing up in a very rural area of Pennsylvania, and then coming to a very urban area. And really, what it taught me was there's a very thin line between struggle and suffering. Mm-hmm. And I think that when I've had such great opportunity in my life. I've had such great people in my life. I still have such great people and great opportunity in my life. It is true. You have a responsibility to give back. And now that I'm a new mom, the one thing you want the most is for the next generation to have it better than you, and for it to be easier. Not easier that they don't have to work for it, but easier for them to achieve and to fulfill potential. So for me, it's all of those things combined. It's really being able to see the humanity, the good in humanity, and then to be able professionally to pursue that in the way that I've been able to has been probably the greatest blessing of all. So I feel very fortunate.
Thank you. Thank you so much. Another question, I think one of my favorite words is partnerships, and partnerships with purpose. And when I look at Black Doctors COVID, and I look at Latina Connection or Kate, I think about partnerships. And I think, again, as you look at all that you're doing, and you're looking at the role in launching partnerships, and more importantly, not just for today, but just sustainability. Okay, it would be wonderful if this would just disappear and just go away, but I don't see that happening right now. But long term, again, as you both look at that, what do you see, or what do you think are some of the initiatives or things that can be done for sustainability, in our communities? Doctors,
specifically for what myself and George are doing. So you mentioned one of them, and it's partnership. It's partnerships, and I can honestly say for Lorena and Heather, in April and beginning of May, when we first got out there, you were the first ones to put a direct deposit in our account. You were the first ones. And everyone else was like, well, how'd she get those tests? Is she a real doctor? Does she really have a nonprofit? Does she have a corporate entity? She's a surgeon. What's she doing? Does she have any public health background? I mean, there were swirls and swirls of questions. And you guys told me to put it on paper and submit it. And it was there. Not months later. It was there. And we needed it. To pay for the rental van. Oh my gosh, I don't know.
Yeah, I know. Hey.
And all the masks and things to keep us safe, and it was so hard to get the N95s, and I wanted folks to keep coming, but I only had so much surgical stuff, eventually it was running out. And so it's those partnerships. I mean, I had neighbor friends who are doctors of mine who weren't operating that just left boxes of PPE on my step with no note, that just left boxes. And so it's partnerships. It's state funding.
Yeah.
I just applied for, hope you're watching, Pennsylvania Department of Health. Applied for a big grant. Hopefully we'll get a portion, if not all, maybe we'll get it all. You got to be out there showing your results, showing how people are benefiting from what you're doing. thanking people every time. Right now, everybody wants to be a part of containment and mitigation. So every time those opportunities come out, and it may mean someone wants you to test people who are pregnant. Someone wants you to test healthcare workers, not healthcare, early learning childhood workers. Some people want you to test the homeless. I want to test anyone who doesn't have access. So if it means we shift and we do that, we have a contract with SEPTA. So we test the SEPTA employees. So that's where the sustainability comes from. And we save, and keep doing the work. And thank God, the attention, the media has been great in terms of writing about us and putting us on the news. That brings more attention. And so, knock on wood, we're good for a couple years, I believe.
Yeah. Good. I'm knocking my table's wood.
Yeah.
Okay, very good.
But I mean, you can't stop. You can't, once you put it in the bank, you can't say, okay, I'm great. No, you gotta keep writing. You gotta keep doing your reports. You gotta keep what you're doing out there, not just for those who fund you, but for the community, because the word of mouth that they spread for you also gives you credibility to the community. So that's how.
Great. Okay, very good. George?
Yeah, I mean, it's really exciting that this small project has created over 50 plus partnerships.
Wow.
It's been amazing. So talk about sustainability. We're already in conversations with organizations like yourself about extending, the tour into a second phase in Philadelphia counties. And we're looking forward to exploring more partnerships with Dr. Stanford as well, and really reach those low-income vulnerable communities. So it's really exciting to see what was just an idea a few months ago is, bringing over 50 plus partners to the table and really talking about how to further, reach organizations and individuals and communities that are mostly in need of these services.
Great. As a matter of fact, I was thinking to myself, as we look at all the partnerships that are coming together, I'm going to make sure that Dr. Stanford, you give your information about your organization, your www or your email or whatever that information is, and George, that you give yours too, because people are watching. And of course, we will make sure that we put it in our material or the chat, but I want to make sure that we have that information, because if people want to connect with you, I think it's important. Now, Heather, I'm going to come back to you for a moment. I've been picking on them, so it's now time for me to pick on you.
Fair enough.
All right. What does, when we think about grant making, or we think about beyond grant making, mean to you? And and we are funders. How important it, again, when we look at those partnerships in philanthropy, and again, as you look at the partnerships that we built and that we're doing. So I'm going to ask if you would just speak about that for it's more. What's my favorite line, Heather? We are more
than a check.
There you go. Very good. All right.
But the check is important.
Yes.
So I would say this really, what we do is partnership. It's what we have to do. It's what a grant maker should do. We alone cannot solve the problems, and we have to work together to realize the opportunities. So that's something that we believe in at our foundation. I know that other funders believe in that as well. But for us, it's really about taking a risk to fund and support approaches to care that really can solve old problems, but also address new problems as they come up. And I think Dr. Stanford was talking about that to an extent with how all of the CDC guidelines keep changing, and how do you be nimble to that, and how do you make sure the right information gets out, and those become new problems on top of old problems. And so you've got to have support. You've got to have funders like us who are willing to take a risk to fund what's happening today, and to think forward, and to fund what's happening tomorrow, and to also work towards changing the things that are really challenging us to have future change.
Yeah.
And so we build on what works. We've got to work together to change what doesn't work, or what no longer serves the needs of our neighbors. And that's something that we take very seriously at our foundation. We look beyond the check. So the grant making is really important. If we don't support the grassroots organizations, then things like this may not happen, or they may not happen as effectively as their creators and founders would like. And so helping to realize those visions is really important to us because we understand the impact that can have in our community. But we also commission research. It's really important that we understand and help inform and improve our programming, and that we understand how to inform and improve others to change. And then we have the amazing opportunity as a foundation to have award-winning publications. And this ties right back into the work that George is doing, the work that Dr. Stanford is doing in terms of communicating. Why not use your platforms to communicate? Communicate your message, communicate the message of others. And for us, I think, Lorena, you would agree, it's one of our greatest rewards in the work that we get to do is that it's not about us.
No, it's not.
And if we had our way, we would not be doing the work that we do, because then that would mean there were no issues that needed to be addressed in our community. But that's not the reality that we live in today. So until that is our reality, partnership and sustainability, along with collaboration, those guide our work. Those are core principles to our foundation. And those are the things that we make sure are part of our actions in every step that we take.
Yeah, and I think again, and Heather, you mentioned that, it's about innovation. What I often say, people say, think out of the box thinking, to which my response is, I don't have a box. All right? So I don't have a box. So let's figure out, how do we do it? Or often I will say, I don't want to just date you. I want a marriage. In other words, how do we have a relationship together? And, so that when things come up, we can work it out. There's always an opportunity. I think much of it, again, goes back to our leadership at the top. I mean, I'd be remiss if, and I mentioned Dan Hilferty, who believes that healthcare is a right, and that's important that people have it. I look at our senior VP, Steve Farah. They believe they're just as passionate about what we do as we are. If they see us come, it's like, what are they up to now? But they don't. And again, we're good fiscal sponsors, but again, they are open-minded to see not what can't be, but what can be. So I appreciate that. Again, as we move quickly, we have maybe about 6 minutes. I have another question. When you look at, again, your partnerships, if there were lessons learned thus far, because you've only, as the songwriter says, and I promise I won't sing, you've only just begun. If you look at where you are now and you kind of look at lessons learned and playing it forward and going forward, whether it's talking about partners or it's talking about people that you would align with, or your mission or your vision, where do you see yourself? Where do you see that at this point? That's a hard question.
Yeah, I mean, I think because so much of what we started doing was filled with integrity and for the right reason. We struggled a little bit because I was so reluctant to partner with anyone.
No, you really?
That's code.
Oh, Lord.
But I was so
true confession. It's okay. Good for the soul.
What would I change? But I felt like I needed to be hesitant because I was sort of the new person on the block, like not new to medicine, but people didn't know me in this space. Right. So I had to be fully vetted, which is fine. I think some people underestimated what we would be able to accomplish. But it was one of those situations where the actions spoke for themselves. And I didn't have to say a lot. I don't think I was offensive. I was just very hesitant to partner. Now, because I've seen and I know our value, it's a real partnership, which is different than someone saying, well, what can you do for me?
Right.
How can you reach what my goal is, which may not be what our goal is, right? So now when you come to the table, I bring something and you bring something, and it's symbiotic, and together we both reach our goals, which may be independent and separate, but we both gain something from that relationship. And I think because we started so bare bones, without relying on many folks, except for you, again, who were true to what you said from the very beginning. We weren't beholden. So we got to be a little bit selective and choose the people who were genuine and shared a similar mission. So in that respect, I wouldn't change anything.
Good. Okay, thank you.
I had to go through. We had to go through.
It was all part of the learning process.
Yes. Yes.
Okay. George, I saw you shaking your head or nodding.
I feel like I'm in the same room with Dr. Stanford right now.
Okay. Well, let the church say amen. Okay.
Amen.
No, I think we've all heard that saying, you can give a man a fish or you can teach a man how to fish. Yeah. And, we have been blessed to find partners like you to get out and give people the tools and resources that they mostly need. Mm-hmm. If there was anything that we could change is we would have started a little sooner. Sure. I think that efforts like Black Doctors and efforts like Kate, the mobile unit, should have been out on the road day one. I think that we're all still swimming in new waters that we didn't know.
We're catching up.
Yeah, we're just catching up. And that's what I would do differently.
But you had no control over that. You could only go with the information you had.
Yeah.
Right?
We're almost there, guys. If there was one thing that if you wanted to, I'll call it a community call to action or something you want to tell people to do, and that's got to be in 1 minute or less. Okay. What would that be? Okay. What would you say to the community, the community that's listening to us today? And I've got my 3 W's, which are wash your hands, wear your mask, wash your hands, and watch your distance. Those are my 3. Okay. That I remind people of. But what would be your, not final words, but words to them?
I would say this will not last forever.
Yes.
Yes, it's taking us away from so many things we love, but it won't last forever. We have to be patient. We have to practice delayed gratification to get what we want. Yeah. We got to follow the rules, as you mentioned, the mask, the social distance, the not large gathering, the good hand hygiene, cleaning surfaces. That in and of itself, even if we never got a vaccine, would save lives. Just these things would save lives.
It's basic.
Stop waiting for someone to save you. You can save yourself with some of those measures. And I would say that. And I would say we're still in a pandemic. I know folks don't feel like it a little bit, but 52,000 people were diagnosed yesterday. 52,000 people. Over 1,000 people died yesterday. And I have to put the numbers there because I don't want folks to forget that we are still in it. Flu season's coming up. Get your flu vaccine.
Will do. We learned something new.
Yes. Okay. Get your flu vaccine.
Will do. Okay. George, your final note?
Yeah, my final note is to help one more person get through this. We are all in this together.
You took my line. We're all in this together. Okay, great. Okay.
You can help to educate one more person, and that person can help to educate another. I believe that all of this will soon be over with, and we are all in this together.
Yes. Right. And again, Heather, did you want to say anything? I don't want to leave you out in case you want to say anything.
I would say if you need help, reach out for help. People like Dr. Stanford and George are there. Their organizations are there. Seek it out and you will find help.
Great. And I can't begin to tell you how proud the foundation is to partner with both George and Dr. Stanford and support grassroots organizations who are creating change, because that's what it's about in healthcare for our most vulnerable populations. And everybody knows I always have a quote. And my final quote is from our 44th president. And he said, I see what's possible when we recognize that we are a family all deserving, an American family, all deserving of equal treatment. With that, again, I thank you for being with us this evening. We hope this conversation has been helpful. Stay tuned. I'm sure you'll see Dr. Stanford and you'll see George hanging around. They'll be doing testing. So, and their information is in the chat box. So again, I can't thank both of them enough for taking time. And Doc, I know how you were juggling, but I also appreciate you. You know, I call her and I'll say, how's my child doing? All right. All right. And George, and I've just fallen in love with George. So George, you're stuck with me too. And Heather, you don't have a choice. So again, on behalf of the Independence Blue Cross Foundation and Independence, we thank you for your time and your attention tonight. Have a great and wonderful evening. Thank you so much.
Thank you, Lorena. Bye.
Good night.